Today's routine is going to work on your glutes and hips. All you need for this is a lacrosse ball and a bit of space. We're going to start with the ball. We're going to work on the glute area. We're going to start with what's called a soft tissue mobilization. And all we're going to do is we're taking the ball, we're going to place it in anywhere on the glute to start with. You can either have your leg, you can either have one leg straight and this leg bent, or switch it over, whatever you prefer to get started with, okay? So this is the same as any other sort of soft tissue mobilization. We're going to use similar techniques that you'd use on all of them. So I'll just take you through them as we do it, okay? So what we're going to do is aim for around 2 minutes each side. And first of all, we're just going to place it, like I said, any area. And you're going to start off with what's called contract and relax. So first of all, you're going to take a nice deep breath in. You're going to squeeze the glute here. You know, it might feel quite sensitive. And all you're going to do is just relax and ease off, okay? So when you do that squeeze, you want it to be nice and slow. So you breathe in, squeeze slowly, don't go too quick. Otherwise, if it is sensitive, it'll just almost take your breath away. Hold that for around 3 seconds and then relax off, okay? Now you can stay in that one area, do a few contract and relax there. Or we can just keep moving around, finding new areas there. Now, if you find an area like this that's really sensitive, you know, you can stay there and see how you get on with it, or it might be better just to move like an inch left or right of that, or just slightly up and down away from the area that's so sensitive, and then kind of just work back towards it as it feels better, okay? Relax there. Now, because the glute is quite a large area, so obviously if, you know, you wanted to revisit this or spend more time just, you know, getting into the glute there, you know, that's absolutely fine. Obviously, everybody's got different levels of tension depending on what you're doing. Obviously, if you've been doing a lot of like heavy squats or anything like that, the glutes are probably going to be feeling it once you start sticking a, you know, lacrosse ball into your butt cheek. So into there, right, okay. So, and I always think a good way to go around things as well is just to sort of like systematically get across the glute. It's just to start like in one place and then move across a little bit, and then move across a little bit, and then down, and then move back across, if you see what I mean. So you can, you know, it'll take probably more than a minute or so to work the whole glute. Hence why I said, you know, maybe spend a bit more time if you need to. Into there, okay? So once we've done like the contract and relaxing of that contract and relax, what we're going to do now is just get a little bit of flossing going. So we're just going to start off in that area here, and you know, we can just grind across that first of all before we floss, actually, like a bit of a pressure wave. So as you can see, again, I'm going down, across, into there, and it might be that you find a really sensitive area that you want to go back to contract and relax to. But all we're going to do now is just move the leg out to the side here. We'll do around 30 seconds there, into there. And what you're doing is just basically rotating the hip, moving the knee outwards here. So you imagine if you know you drive your knees out when you squat and all things like that. Obviously some adductors come into play and all the rest of it. But in general, what we're looking to is just to free up the glute so that, you know, it can rotate, the hip can rotate, and you can move, okay? Into there. Just do one more of those. Into there, okay? So now we're going to the other side, and then we'll move on to the next mobilization. So again, same sort of thing, starting off in here, we'll do about a minute or so into there. Breathing in, contract, and relax off, okay? So I generally start quite highish. And as I said, I kind of work my way across gradually towards the hip. Obviously, don't go onto like any sort of like pelvis bone, your hip bones or anything like that. Always just keep it into the soft tissue, hence it being called a soft tissue mobilization. Soft tissue is your muscle. You know, this isn't, you'll know anyway, if you go and put like a lacrosse ball on bone or something, it's not going to even feel right, so you'll just take it straight away. So moving across there, and again, like as you can see, sometimes I feel like, especially when I get out here, sometimes I feel like straightening my leg a little bit more rather than having it bent. So that's all about personal preference, really. Like if you feel, you know, better, just sort of like getting the ball into an area with your legs straight, it doesn't really matter. Okay, just down a little bit. Okay, so that's a minute there now. Let's just do another 30 seconds in that area. I'm just going to work back towards the middle a little bit. So here, when you get into the center of the glute, you know, like the sort of mid, you can start being a bit sensitive there. So again, like I said, if you need to, just start an area about, you know, above or below that, or side to it, an inch or so. See how that area feels, and then you can like sometimes loosen all the area around it and then work your way back into the area there, okay? Okay, good. So just change that here for this pressure wave. So all we're doing is starting across there, you just literally work across that and keep this nice and slow as well. You don't want to be you know, moving back and forth. That's not going to do anything. You imagine like you've got a knot or something there that you're trying to smash through. If you go it like really fast, it's just going to be, you know, it's just like hitting a jump. You're just going to pop straight over the top of it, not really run through it. I heard a good term actually, you know, try and treat it like it's almost like an icebreaker. You know, like it's really slow. It's just coming along and it's just smashing through anything in there that doesn't feel good. So that's sensitive there. Okay, good. So once you've done there, what we can do, again, 30 seconds now, we'll just get some flossing in there, open out. And again, you can do this straight leg as well. You can put your leg down, just move your foot out to the side. I don't personally find that as effective as this, but there's nothing to say it won't feel good for you. Just having, you know, just having your leg rotate out to the side like that instead. You know, it's doing, the hip's doing the same thing. It's just different levers, you know, into there, okay? So what you should find now, you know, once you've done, just loosen up the glute area, that starts to make the glutes feel a bit looser. So now is a good time to, you know, explore, you know, sort of squat position and stuff like that. So some of you might not be able to get down into a deep squat position just yet, but what we're looking to do basically is get into that position one leg at a time. Now, if you need to, it might be that you find this better propping your leg up onto something like a chair or something and doing it in a bit of an elevated position. Doesn't require so much mobility in the trailing leg hip, but I'm just going to show it on the floor today. So try this out. Like I said, prop it up, leg up on a bench or something if you need to. So I'll show you like this. You don't have to set it up like this. I personally just sort of get into it like that, but I'm just showing that essentially what we're doing is we're squatting one leg at a time. So we bring that leg back here. We keep this hand on the foot here just to stop it rising up and stuff. Push this back hip forward. And all we're going to do first of all is take your arm here. We're just going to rotate here. And it's just going to run through a routine for a minute or so. And when you're in these positions, just breathe. Relax there. So this hip here is in a nice deep sort of flex position, plus rotating out similar to how it would be in a squat. You're even going to feel it up the side of your ankle a little bit there, which is always good. Just making sure don't let that lift up. Just keep your big toe down. Use the hand for that. And then come back to the middle now. Lift up your chest. And we're going to walk both hands out to one side. So you've had to take your hand off your foot now, but you should find, you know, it's a bit easy to keep down now. Now, one thing I like to do is grab my hand here, force my leg out to the side, so you've got your head going one way, your knee being pushed the other way. Big breath into there. Hold that position. Come back to there. Then the next one now, we're just going to see if we can bring the elbows to the floor. Obviously, if you can't, just, you know, you might find that you can't bring this elbow down, or you can only bring one elbow down. So do your best to get in that position, even if you're just into there, hand on the floor for now, gradually. And again, squeeze everything. Relax. And then try and get into it a little bit more. Contract everything. Force yourself down into there, okay? So that's the goal. Try and get 2 elbows down. No, if you can't do that at first, keep working at it and you will. Lift your chest up a little bit. Into there, okay? So again, come back to that position. Like I said, I like to just either get into it like that, or you can just get into a deep squat if you can do that. Put your hand on your foot, bring that back into there. We're going to rotate. Just bring your leg onto there. Just hang out on your leg here. Nice breath in. Relax. And see, just rotating that hip towards there. And then what we're going to do is come back to the middle. Again, bring both hands out to one side. Take that hand, force that out. If you don't feel comfortable forcing it out there, and that's enough for you, just keep your hands here. But I think personally, just get in there, try and push that out to the side. Into there. Remember to breathe. Don't hold your breath in these positions. Try and relax into them. Part of this is just trying to let your body know that, look, we're all right in these positions. You don't need to keep sort of not letting us into it. So I see here, look, this side here, I've got a bit of a dodgy ankle at the moment. It's not feeling quite so good in terms of moving out there. So I'm struggling a little bit to get that down. I can just about get it down. But I am feeling that pressure on the outside of my ankle there. That's just sporting injury. It's nothing from life. Just a couple more there, a couple breaths. So again, look, I'm going to have to come up there just for the pressure on the ankle there. It just doesn't feel very good at the moment. It's good to get myself in that position, but not that far, you know. And then breathe in there, okay? And these might be things that you come across as well. You might find that you've got a pain in an area. Like, for instance, my foot just got twisted my ankle. That's why it's hurting, you know. It might be that you've bashed your knee a little bit or something like that. That doesn't feel quite comfortable in that position. So you know, there's always ways to work around things, find a way, you know, to make it work. But there you go. So that's the routine. Follow that through and move on to the next one.